I'm Dr. Laura Schlesinger. Here are some questions. Can a 10, 12-year-old kid sign a contract? No. Why not? Because they're not mature enough. They don't have the knowledge and wisdom to make decisions like that. Do we let 10 and 12-year-olds drive? And I'm not talking about on a farm. No. We don't consider them mature and responsible enough. It would be more dangerous on the road. Do we allow 12-year-olds to join the military? No. I mean, there are countries all over the world on other continents who do that all the time. Africa, the Middle East, all kinds of places. Do we let them do that? No. Why not? Because we consider them not mature enough to make that kind of decision knowingly. They don't have the understanding of what it all means. They're not making an informed choice. I mean, I could go on, but I think you're getting the notion. So why do we think a 10, 12-year-old should be able to do what's getting to be all the rage these days? I mean, it's becoming all the rage. You have special status. Everybody applauds you, holds you up. Anything you want is fine, as long as you say, I'd rather be a girl, I'd rather be a boy. So we allow little kidlets to decide that we should take off their penises and close up their vaginas and take off breasts and take off, I said penises already. We should say that twice. That's a major thing. And hormone blockers? Because we think, what, they're mature enough to make those decisions? Really? Suddenly? That alter their entire lives? I think that's nuts. The American College of Pediatrics released a position statement on February 7th stating that social transition, puberty blockers, and cross-sex hormones have no demonstrable long-term benefit on the psychosocial well-being of adolescents with gender dysphoria. Quoting, a review of at least 60 research papers demonstrates no benefit to social affirmation, puberty blockers, cross-sex hormones, or surgical interventions from these youth. I'm just going to read the highlighted things. Youth whose perceived gender identity does not align with their biological sex have high rates of mental health problems, regardless of any affirmation of their gender identities. Adolescents who identify as gender incongruent often have existing mental health illnesses, including depression and anxiety. They also state that over half of the LGBTQ plus sexual minority individuals experience adverse childhood experiences, including abuse. Meaning, it's very complicated, and the psychosocial issues are bigger than a penis or a vagina. Transgender youth reported the highest levels of abuse and neglect. The researchers said their review casts doubt on claims that social affirmation, like using desired pronouns, or transgender identified youth helps their long-term psychosocial well-being. Quote, adolescents have immature brains, should not be allowed to make decisions that have lifelong implications, such as decreased fertility when they're so young. In terms of specific therapies, researchers found that the use of puberty-blocking drugs, medication that delay puberty in children, did not have significant benefits for youths experiencing gender dysphoria. A study that purported to show lifetime suicidal ideation reduction in those who received puberty blockers actually found twice as many serious suicidal attempts in participants who received the blockers than those who wished they had received them but didn't. So I think there are a couple of more quotes that are probably important. The review also discovered that many teens who pursue gender-affirming therapy, whether surgical or hormonal, ultimately revert to their biological gender. Quote, "There are individuals who now express regret regarding the transition because they're making these decisions as children." Dr. Brett Osborne, a Florida neurologist, said, "I agree with the position statement of the American College of Pediatrics. A holistic approach with intense psychiatric interventions should be adopted prior to any gender-altering therapeutics." I remember, while taking hormone-altering therapies or transitioning to the opposite sex has become, quote, "all the rage," the data suggests there is no long-term mental health benefit. In addition, those opting for hormone-altering therapies are potentially interfering with not only sexual development, but brain development. Testosterone and estrogen, the hormones primarily manipulated with such therapies, are integral to memory formation and mood and functioning of the brain. The doctor also noted the dangers associated with gender-affirming surgeries. Quote, "Adolescents, prior to undergoing intense psychiatric therapy, are opting for sex change operations in an almost whimsical manner. But this is short-sighted, and the decision is often tainted by ongoing psychological issues. Such surgeries permanently alter one's physical appearance, carrying with them irreversible consequences, such as infertility and sexual dysfunction. Adolescents haven't lived long enough to make such high-level decisions. They're confused, and an alternative must be sought. The hormone-altering therapies interfere with sexual development as well as brain development." Dr. Mark Siegel, clinical professor of medicine at NYU Medical Center, pointed out that many UK and European countries, from Sweden to France, have restricted gender-affirming care for adolescents in favor of mental health support. And they're pretty liberal. Sweden, yeah. So some places are showing sanity.